Like everyone else, I am a regular human being with health problems, even though next year Jacqueline, a teenager who was born with a rare facial tumor that prevents her from speaking or eating, will graduate from college. The girl, according to medical reports, was not supposed to live to see her first birthday. The teenager, who has always been the target of unkind remarks and looks, is optimistic about the future. "People usually point and stare at me," she remarked. "Individuals do say hurtful things. Their inability to know me well enough to say hurtful things makes me sad. I'm just an everyday person." The incredibly rare illness known as lymphatic malformation causes Jacqueline Rodriguez, a 17-year-old from California, to develop a big tumor in her tongue and cheeks. She uses an iPad for communication and a formula feeding tube for eating, but she still enjoys playing tennis and the guitar in her free time and plans to attend Stanford University to study nursing. She told Barcroft TV, "I want to be a nurse because I grew up in a hospital helping my nurses take care of others." Jacqueline's doctors never thought she would live past her first birthday. However, the 17-year-old from California, who has lymphatic abnormalities, is remarkably persistently surpassing expectations. Her strong support system of close friends and family, along with her passion for athletics, has enabled her to survive cruel remarks. "Playing tennis gives me confidence because I know I'm strong enough to play a sport," she remarked. "It's unbelievable that Jackie will soon graduate from high school," stated Jacqueline's 19-year-old sister Claire. "She has made so many new friends who all adore her, which makes me happy, and I'm quite proud of her with the tennis team. Jackie is an excellent model for everyone to aspire to be like. You can't tell her no if she sees something she wants to do. She doesn't care what other people think. She'll always make an effort to complete it. She is motivating." The girl struggles with communication, but her parents are confident she will overcome her obstacles and achieve. "I feel very comfortable that she will grow up to be successful in anything she does," stated the girl's 60-year-old father, Paul Rodriguez. "I have never known a more incredible person than her. We are incredibly proud of you for overcoming so many challenges while maintaining your courage and tenacity. All the tiny child wants is to survive. She smiles when she wakes up every day, and it just gives you hope. The best thing that has happened to us is her. She has dreams for the future and is looking forward to them." Evelyn Belen, 52, her mother, said that during her pregnancy with Jacqueline, medical professionals informed her that her daughter would have a very poor quality of life and that she had the choice to end the pregnancy. "We went with life," Belen declared. Jacqueline underwent her first surgery at the age of 3 days. Her father, Paul Rodriguez, said, "They removed 2 almost golf ball-sized tumors from her throat. She was first unable to swallow at all. Her G-tube had to be used to administer her formula." They clarified that although the tumors recur, several drugs and therapies are preventing the illness from getting worse. What is lymphatic malformation? Clusters of swollen and/or malformed lymphatic channels that malfunction are known as lymphatic malformations. The organs, spleen, thymus, tonsils, and adenoids, lymph nodes, and tiny tubes, lymphatic channels, that transport lymphatic fluid make up the lymphatic system. An essential component of the immune system is the lymphatic system. It also aids in the removal of surplus fluid from the body's tissues. The lymphatic fluid moves more slowly, or not at all, in lymphatic abnormalities. The result is an accumulation of excess fluid and an enlargement of the lymphatic vessels. In the afflicted area, this results in swelling and cysts, or fluid-filled pockets. Lymphatic malformation causes. Before birth, lymphatic abnormalities develop. They result from issues with the lymphatic vessels' development and formation. Pregnancy-related drugs, medications, or environmental exposures do not induce lymphatic abnormalities. The majority of lymphatic abnormalities are discovered in infancy or at birth. Some, if they are tiny or confined inside the body, could not be detected until adolescence or the early stages of adulthood. Malformations of the lymphatic system can affect any bodily component. The head and neck are where they are most prevalent. They may affect more than one bodily part. The size and location of the abnormality affect the symptoms and consequences that may arise. Formerly, lymphangiomas or cystic hygromas were terms used to describe lymphatic abnormalities. What kind of malformation is lymphatic? The appearance of lymphatic abnormalities varies. The aberrant lymphatic channels are classified as macrocystic, microcystic, or a mix of the two based on their size. Under normal or blue-colored skin, macrocystic lymphatic anomalies are huge, fluid-filled cysts that resemble smooth, soft masses. The microcystic variety resembles a swollen region and is sponge-like. Lymphatic lymphatic blebs, or fluid-filled vesicles, may also be present above the lesion in microcytic lymphatic malformations. Little, elevated skin lesions called lymphatic blebs are filled with transparent lymphatic fluid. Typically, blebs resemble blood blisters or blisters. The blebs may also turn black or dark purple when blood seeps into them. In people with lymphatic anomalies, overgrowth or enlargement of a body part, such as the lip, cheek, ear, tongue, limb, finger, or toe, may also happen. Certain lymphatic abnormalities are located within the body and are not visible without specialized imaging. What potential lymphatic malformation complications are there? Cellulitis, or an infection of the skin or soft tissues, may develop around the deformity. Usually this occurs when germs enter the body via lymphatic blebs. An infection that is more dangerous or perhaps fatal could develop from cellulitis. To cure these infections, antibiotics must be used right away. People who have lymphatic abnormalities in the head and neck region, particularly oral deformities, are susceptible to recurrent and potentially fatal infections. This occurs when oral bacteria infiltrate the deformity. Keeping your teeth clean reduces these infections. Frequent dental checkups and toothbrushing are advised. Pain and edema could result from bleeding into the malformed area. This could happen randomly or as a result of trauma to the region. Skin blebs may ooze or bleed lymphatic fluid. Deformity and chronic discomfort are also possible. There could be further challenges as well. For example, breathing, eating, drinking, and speaking difficulties could result from a deformity of the windpipe, tongue, or chest. Chronic diarrhea and loss of vital proteins might result from an abnormality in the stomach or intestines. A chest deformity may result in an accumulation of fluid surrounding the heart, pericardial effusion, or in the lungs, pleural effusion. Breathing and heart problems may result from this. Ascites, or an accumulation of fluid inside the belly, can result from an abdominal deformity. Urinary or bowel problems can also be brought on by malformations in the abdomen. This is an abdominal leak of lymphatic fluid. Treatment and management. Is it necessary to treat my child's lymphatic malformation? People who have lymphatic abnormalities ought to be examined by a physician or a group of medical professionals skilled in treating these disorders. Every patient has a different course of treatment recommended. How are diseases of the lymphatic system treated? A cure for lymphatic abnormalities does not exist. Surgery cannot eliminate most lymphatic abnormalities. The extent, location, and depth of the deformity determine how it should be managed. Multiple therapy options are available. Among the numerous treatment options are observation compression therapy. This entails covering the afflicted body part with a tight-fitting fabric to stop the pain and the abnormality from getting worse. Sclerotherapy. To reduce pain and/or shrink bulky portions, a drug is injected into the deformity during this surgery. Drug therapy. A variety of lymphatic malformation symptoms and consequences may be treated with medical sirolimus therapy. This drug comes in the form of a gel, lotion, or ointment. It is used on blebs of lymph. Oral sirolimus. This drug is used orally. Sirolimus used orally is used to treat severe or intricate deformities. Intravenous (IV) administration of zoledronic acid, Zometa. This is the recommended method of administration. Bony lesions that are troublesome can be treated with Zometa. Research trials are presently being conducted to examine investigational drugs. Excision through surgery. Some minor lesions may require total surgical removal. To remove excess or overgrown tissue, surgery may be necessary. Laser therapy. To cure bleeding or leaking lymphatic blebs, this method uses specific laser beams. Orthopedic procedures. To treat problems with bone overgrowth, surgery could be required. Jacqueline doesn't allow her condition to stop her from being a typical adolescent. She still uses an iPad to communicate and eats through a feeding tube. Throughout her life, medical professionals have attempted to remove a few of Jacqueline's tumors, but the mass consistently returns. In the absence of a treatment, researchers are investigating a less complicated method to manage Jacqueline's tumor cells' growth without causing her undue agony. Have you ever been in a circumstance comparable to Jacqueline's? Could you elaborate on a particular challenge brought on by your illness or allergies and how you resolved it? Tell us in the space provided for comments below. Give our channel a thumbs up if you think the stuff we offer is valuable, and please share your thoughts about our story in the comments section below. To get the latest update, kindly hit the subscribe button. Thanks for watching. See you in the next video.